Well, hello, everyone. I'm Dr. Leslie Kernisan, board-certified geriatrician and the founder of the website betterhealthwhileaging.net. And this is the Helping Older Parents video podcast, where I cover the best ways to support aging parents and other older loved ones so they can live better lives in their later years. I also often address common caregiving concerns and dilemmas, like what to do if you're worried about an older person's memory or safety, how to deal with Alzheimer's and other forms of dementia, and how to help your older loved one get the care they need. In today's episode, I'm going to explain 21 signs and behaviors that are not normal aging and may in fact be signs of Alzheimer's or another form of cognitive decline in an older person. These are symptoms that I myself check for if an older person is showing signs of memory loss or if a family is getting concerned about their aging parents. I do have a particular interest in educating people who are concerned about their aging parent, so in this video, you'll hear me mainly refer to that scenario. But of course, you can use this information if you're concerned about your older spouse, if you're concerned about another aging relative, if you're concerned about a friend, or you can even use it to consider your own concerns about your memory and thinking. Now, before we get started, I just want to note you cannot and should not use these signs to attempt to diagnose your aging parent. Only a qualified health professional can do this. But what you can do is learn what signs and behaviors are concerning, so that if you're noticing these signs, you'll realize that this could be an indication that there is really something going on and that something requires attention. So the idea is that knowing these signs can help you get a sense of how important it is to be really concerned or not. Plus, if you do end up pursuing a medical evaluation, and if you are seeing many of these signs, you really should pursue that, this information will be really valuable to the health professionals who do the assessments. So, in the rest of this episode, I'm going to take you through my list of concerning signs, symptoms, and behaviors. I've counted, and I have 21 to share. None of these should be considered normal aging. And then once we've gone through the list, I'll tell you how I recommend you use this list and tips for taking next steps if you found that your aging parent is showing many of these signs. Also, if you are someone who has been worried about an aging parent, you can find this list in a helpful cheat sheet format in my book, When Your Aging Parent Needs Help, a geriatrician's step-by-step guide to memory loss, resistance, safety worries, and more. So, we're going to get started. But before I get into that, I have a very quick request, which is if you're here, you find this topic interesting, or you've been finding my video podcast helpful, if you haven't yet subscribed, if you could please go ahead and subscribe. It would mean a lot to me. It does help me out in that it helps other people find the channel when you subscribe, and it does help support the work I'm doing. Okay, moving on. As I go through each sign, I want you to ask yourself whether you've been noticing this sign never, sometimes, often. And I also want you to pay special attention to signs that have come on later in life for your parent or that seem worse than they were a few years ago. Okay, so sign number one. Sign number one is, have you noticed any signs of poor judgment? So this means behaviors or situations that suggest bad decisions. So some examples might include worrisome spending or not noticing a safety issue that others are concerned about, or maybe not understanding the implications of a really major financial transaction. Number two would be reduced interest in leisure activities. This means being less involved and interested in one's usual favorite hobbies or activities. And you should pay special attention to this if there isn't a physical health issue interfering with doing the activity. So for instance, if your parent has always really enjoyed, say, playing golf, right? And they've stopped playing golf. Is the issue that they're experiencing arthritis that is making it really hard for them to walk or stand, or maybe in the shoulder to swing the club? Or is it just that they don't seem interested or they get bored or confused when they're doing the activity? That's what you want to be thinking about. Okay, sign number three is repeating oneself. So if your parent has been repeating questions or stories, especially during the same conversation, make a note of this because this is not normal aging. Number four, have you noticed any difficulty with them learning to use something new? So for instance, are they having difficulty with a new kitchen appliance or a new gadget or a new remote control? This can be a tricky one to decide on because gadgets do become more complicated every year. And to be honest, I myself sometimes struggle with them. But if you're noticing anything that seems, worse than it was a year or two before, or really more than you'd expect, jot that down. Number 5, forgetting the year or month. Now, especially once one retires and stops working, it can be really easy to lose track of the day or date of the week. However, if you notice your parent is forgetting what year it is or what month it is, getting confused about the season, that is definitely should not be considered normal, and you'll want to make a note of that. Number 6 is difficulty managing money or finances. So some common examples might include having trouble paying bills on time, struggling to balance the checkbook, or otherwise having more difficulty than they used to have in managing finances. Number 7 is problems with appointments or commitments. So if you've noticed that your parent is having more trouble keeping track of their appointments or commitments, or of their plans, you want to make a note of this. And then number 8 is daily struggles with memory or thinking. Now, it is normal as we get older for the brain to just be a little bit slower than it used to be. So it's normal for older adults to take a little longer to remember things since these brain functions are slowing down as we get older. However, if it seems that your parent often can't remember things that happened, or is more confused about things that happened recently, or is more confused with their thinking, you want to make a note of this. So that is 8 signs so far. Now, there are several more that I check for, and I'm going to take you through those in a moment. But I want you to know that the 8 that I just went through have actually been clinically validated. Those 8 signs were included in something that is called the AD-8 Informant Interview. It was developed in the early 2000s by neurologists who wanted to identify practical questions that families or other informants could answer to help check for possible Alzheimer's or other forms of dementia. And what they found is that the more of these signs were present and noticed by a family member, the greater the likelihood that the older person did have a dementia such as Alzheimer's or related dementia. They actually found that having 2 or more of these signs was a useful cutoff. So this is an interesting paper. I will post a link to it in the related notes for this episode. So these 8 signs are known to be important, and I always start with those 8 signs. But we also know that there are many other behaviors and signs that are not normal aging and that often are associated with some form of cognitive decline, with some form of developing an ongoing problem with memory or thinking. So I do use an expanded list, and let me now take you through the other signs that I check for. So number 9 is paranoid or suspicious thoughts. This means having thoughts that are fearful or distrustful of others. And common examples include questioning the motives of others, being worried about theft, being worried about intruders, that sort of thing. I also sometimes include in this making false accusations. And that is related to number 10, which is delusions. So a delusion means believing something that isn't true or real, believing something that most people around you don't believe to be true or real. So believing that a family member is an imposter or a stranger, that is a type of delusion. And it is also pretty common for there to be overlap between paranoia and delusion. So paranoia is the fear that, something often that other people find improbable might be happening, and the delusion is being convinced that it did happen. And so a very common form of this is when the older person starts accusing other people of taking or stealing things. Number 11 on my list is visual or auditory hallucinations. So a hallucination means seeing things that other people don't see, or hearing things that other people don't hear, or otherwise sort of having a perception, a sensory perception that other people aren't noticing, or is kind of being created in the brain instead of by reality. So seeing things, especially children or small animals, is especially common in certain forms of brain decline, such as Lewy body disease. Number 12 on my list is personality changes. So has your parents started to behave very differently compared to before? Perhaps they're more agitated or easily annoyed, whereas they used to be laid back, or maybe they're quiet, whereas they used to be lively and talkative. Another one that sometimes goes into this would be, somebody who used to be tactful and is now blurting out a lot of, awkward things. That could be also considered a personality change, which is related to number 13 on my list, which is embarrassing behaviors. So if your parent has started saying socially inappropriate things or otherwise behaving in a way that is embarrassing, this is sometimes referred to as becoming unfiltered. This is not normal with aging. It certainly might reflect a change in the brain that, has interfered with our normal adult inhibitory functions that keep us kind of polite and socially appropriate. Number 14 is lack of insight. This generally means showing a lack of awareness of one's difficulties. So denying they're having a problem that seems obvious to others. It can also mean poor awareness of how their behavior is affecting those around them. This is also sometimes called anosognosia, or related to anosognosia, which is a long word that basically means not knowing of one's sort of medical problems. Okay, number 15 on my list is verbal or physical aggression. So for verbal aggressions, examples include threats, name-calling, insulting others, whereas physical aggression could be throwing things, hitting, biting, kicking. You get the picture. Number 16 on my list is significant fluctuations in mental abilities. So this means having moments, usually within a single day, when the older person seems practically normal, and others in which they seem quite confused or unable to pay attention, or they might even seem totally spaced out or zoned out. Number 17 is difficulty paying attention or focusing. So has your parent frequently become spaced out or unable to pay attention to what you are saying or doing? So a kind of, more specific version, again, of the fluctuation in mental abilities would be difficulty paying attention or focusing. Number 18 on my list is getting lost in familiar places. And getting lost can happen either when someone is on foot. Occasionally it happens when they're in their house. That tends to be relatively late. Usually people start off by getting lost in familiar neighborhoods, familiar stores, or sometimes they might get lost when they are driving. Speaking of driving, number 19 on my list is driving getting much worse. So some common difficulties that people experience would be difficulty parking, confusion at intersections, poor awareness of other vehicles on the road, or even confusing the gas and brake pedals. Another thing that families sometimes notice is new scratches or dents, or worse yet, accidents. That would also be quite concerning. Lots of traffic tickets would also be concerning, especially if it's much worse than the person's historical pattern for getting traffic tickets. Number 20 on my list is signs of depressed mood. So does your parent frequently cry, look glum, or even seem unaffected by things that once brought them joy, or otherwise seem more down than before? And then number 21 on my list is increased anxiety or worry. Has your parent become more nervous, stressed, worried compared to before? Now, about those last two signs, both depression symptoms and anxiety symptoms are quite common in older adults. They're common actually in people of all ages, and they do affect people in later life as well. So if you're noticing that, I don't want you to panic otherwise about cognitive decline. But if you see depression and anxiety in the context of your parent also showing some of the other signs on this list, it's really important to bring up the other signs if you choose to ask a health provider about depression or anxiety, because we are going to think about depression or anxiety differently if the person otherwise seems cognitively fine than if they are showing other signs of repeated questions, problems with memory, getting lost, or things that might make us worry that their brain is changing in a more substantial manner. So those are my 21 signs. So let me now give you a few suggestions on how I recommend you use this list. My suggestion to you would be that you start off by observing your parent for a few days and talk to others who see your parent often. Make note of whether you are noticing these issues never, often, or sometimes. Review what has come up. Because again, these are not signs that we see in people who are experiencing normal aging. So if you're seeing this, you don't want to attribute it to, oh, well, they're just getting older. It's what happens to people when they're in their 80s. I mean, yes, it does often happen to people in their 80s, but that's because as people get older, they're at higher risk for something significantly affecting their brain. And we want to know if that's happening because sometimes it's even possible to work it up and even make it better. And I'm going to talk about what doctors should check in, one of the other related videos. So be sure to check for that. If you are observing concerning signs, yes, these can be signs of something like Alzheimer's or another dementia, but you don't want to assume that it's that. There are other medical conditions that can really scramble people's brains. So you don't want to assume that's what it is. I mean, honestly, it might be, but it also might not be. There are other causes of cognitive decline and cognitive impairment in older adults. And so we want to notice if there are these signs because we want to then help them get evaluated and see what we can do to help them get better. So I am going to cover the common causes of cognitive decline and cognitive impairment in a related video, and I'll also talk about what doctors should check. So finally, for more tips on the next steps to take, I have more tips in my book, but I will also be posting more videos to walk you through like the various things that come up if you are in this situation. So if this situation resonates with you, I hope you'll subscribe to the channel. That's the easiest way to be updated as I post new videos. And so that's it. I hope this video has helped you understand what's normal and not normal when it comes to aging brains and when to be concerned about a potential memory or thinking problem. Thank you so much for watching and taking the time to learn more about what to look for. And I look forward to seeing you again soon on another episode of the Helping Older Parents video podcast.